So I'm just going to do the notice of summons for the meeting now. I would like to remind everyone who is in attendance that this meeting will be broadcast live via the Council's YouTube channel, and it will be available for viewing by the public and media. The broadcast will also be available for repeated viewing at a later date. The broadcast may be terminated or suspended in accordance with Council protocol. By participating in this meeting, you are consenting to being filmed and to the use and storage of these images for broadcasting or training purposes outside the purpose of keeping historical records and making these records available to the public. A copy of the Council's privacy notice may be found on the Council's website, www.derryinstraban.com. Thank you. Okay, have we any declarations of interest? Martin?
Thanks, Chair. Items 8, as I'm a member of the Peace 4 Board, and items 22, as I'm a member of the PCSP. Thanks.
Councillor McHugh?
Item 8, as a member of the Peace Board.
Councillor Duffy?
8 and 22, Peace and PCSP.
Stephen? Anybody else?
Here.
Okay.
Can I declare number 20 and 24 too, please?
Okay. Councillor Burke?
My organisation has an application on the Community Support Fund.
Okay. That's everybody? I'm sure I've just noticed the director, Karen McFarland, is not well at the minute, so she's off today. So I have Lorraine here to my left. And thank God for her. We're moving now into the deputation. We have a deputation from Alan Filson and from Conor Reddy and an All Ireland NHS. So whenever the deputation is ready to go. Thank you. Thank you, Alan and Connor, for your deputation. An interesting concept. I agree with a lot of what Alan says, and I suppose I should have declared an interest myself, and that I am a proud member of Unison. And Alan and myself sit on a health service group, and dare I say it, we do good work. So it's good to see Alan in here. I'm into my 30th year now as an NHS employee, so I'm passionate about the NHS, and there is a staffing crisis. There's no doubt about that, and it is unfortunate that a lot of the nursing homes in this part of the country have went to private healthcare or private owned. And when health becomes a budget and is run for profit, I think we're going in the wrong direction. So I'm going to open it up to the floor. Uh, um, Councillor Riley is the first I saw, and everybody will get an opportunity to speak. So, Councillor Riley.
Thank you, Chair, and thanks to Connor and to Alan for joining us here this afternoon. I appreciate you taking the time to come in. In these circumstances, it's not easy to attend public buildings and public meetings, so thanks for taking the time to come along today to inform us about your campaign. It has already been to our council chamber, and we supported it when it arrived in previously, but happy to hear from yourselves and to outline that support again this afternoon. Chair, it's no surprise that that the people talk about the campaign for an all-Ireland National Health Service, and while that may bring some political connotations, I think that the group has shown that if you look at health across the island, there is a need for an approach that fits island-wide in relation to how we deal with the healthcare of all the citizens who live here. I think if we think about the fact that the pandemic has brought into sharp focus some of the gaps that are in the health system currently, it would be completely remiss of us if we felt that the pandemic was the cause of these problems and not necessarily just the magnifying glass through which these problems were in place before have been brought into sharp focus. Because if you think about the fact that we had the longest waiting list anywhere on these islands within this jurisdiction before COVID-19. If you think about the fact that prior to COVID-19 we had staff out on strike asking for fair wages, we all remember the campaigns in December before the restoration of the Assembly, and I have to say I think it was that campaign, that drive from our healthcare workers for fair pay, that led to an agreement and ended 3 years of political stalemate. And you think about even today, excuse me, if you think about even today about the fact that we have the adult safeguarding bill published today by the Minister of Health, again the issues that led to that bill being produced all predate COVID-19. So whereas the pandemic is certainly giving us reasons to think differently, it in no way is the cause of the problems that our health service face, both here and in the Republic jurisdiction. I think within the inequality, there is a free system here, and I know across in Donegal and elsewhere there's a different system, but the concept of free from cradle to grave is not the system that we have, unfortunately. If you think about the fact that people who have free care, often that doesn't mean anything to them if they're being told they have to wait for years to get the service that they need now. That within the waiting list system, there are people who can afford to pay to get their treatment done privately, and that gives them an advantage ahead of other people who can't afford to meet those costs. And you also then have in the likes of the social care sector, you have people being asked to pay for care of their loved ones, while other people who have similar conditions and debilitating illnesses that resulted from other illnesses end up finding themselves not having to pay for social care, and others find themselves being hit with huge bills for that type of care. So I think that whereas in this jurisdiction we do pride ourselves on the NHS, I think that we have to recognise that although it is free, often it still brings big difficulties for people in terms of the waiting lists that are associated with it. So with that in mind, I think it is important that we all commit to not going back to the circumstances that we had prior to the pandemic, and that we do embrace this opportunity to build back better with a better system of healthcare that will serve all the citizens across this island in a much better way. So, can I conclude by thanking the campaigners here today for for leading on this. I think that that governments of all levels, at local level, at regional level, and at national level, need to hear the message that has been delivered by people who want to see what's best for the healthcare system, and that, as I said, involves changing and building back better than what we've had in the past. Thank you, Chair.
Thank you, Councillor Riley. Councillor Duffy.
Thank you, Chair, for allowing me in. And Colin and Alan, you are very welcome to the Chamber today and for the presentation. And you started off about where your campaign started off. I think Sinn Féin's campaign started off a long time ago, but we are really supportive of this in terms of where it's moving and where it's shifting. And I think the more people that we have campaigning around these issues, the better. As a city and district, we have seen the benefits of what we can achieve if we work in a cross-border way. We have seen the cancer centre here at Galvin, which has been a tremendous asset to Derry and Donegal, both. So we know the benefits and we see them very much. You highlighted in your presentation some of the issues around the healthcare system, and unfortunately, when you're putting healthcare up against the economy, you're always going to come up against problems. They're contradictory priorities. They simply are. There is no way that you can slash budgets and cut corners and then still expect the same high standards of care. So I would agree with you wholeheartedly in that. I think that we do need to be making a lot of noise around all these issues. I think that there is a lack of services both north and south, particularly around mental health, and you mentioned it yourself. Today is World Suicide Prevention Day, and I think that particularly here as a city and district, we have a lack of services here, and we need to be making noise about those. And I know that it's not particular to the city and district; it is an all Ireland thing. So the more noise that we can make, and the more people that we can get making that noise, I think the better for us all. As a party, we have always advocated for the retention and the establishment of more public services, and that's where our heart and our focus lies. We do believe at healthcare free at the point of delivery, so we will always support that and we will always be moving towards that. It is our view that there's no other system that can work better for our people, so that the establishment of an All Ireland healthcare system is a no-brainer for ourselves. Let me see what other notes I took there. Um, just in terms of ourselves, we do believe that partition has failed in terms of both jurisdictions in healthcare, and we have our own policy paper that we published. I think it was back in 2017 around the National Health Service. We believe that we should be looking at taking the best from the north health service and the south, and we can come up with a really good world-class health service that is free at the point of delivery for all our citizens across the country, and we believe that that's achievable. It made sense when we published the policy, but particularly now when you look at the failings in healthcare as a result of that we're just exposed with COVID in terms of not having that joined up approach. So I think that they're really relevant now, and the fact that you have established this campaign, I think that we can all work together in that, and I think that the progress can be made, and the more people we have, the more noise we make, and the more progress we can make. So I'm fully supportive of the campaign.
Thank you, Councillor Duffy. Alderman Devaney.
Thank you, Chair, for allowing me in. First of all, can I welcome Conor and Alan to the Chamber today? It's a very interesting presentation. Some of the stuff on it I would agree with. Free at the point, healthcare free at the point of delivery. And look, basically we have that in Northern Ireland. But you know, I talk to people in the Republic of Ireland when they go to visit their GP, by the time they pay their GP, and they get the prescriptions. Some of them are out probably in around €100, maybe I've heard even 150. Depends on what medication is that person needs at the time. We talked about safe staffing. And I do appreciate that during the strikes, the nurses' strikes here for a better pay rate. The issue about safe staffing at that time was around numbers of staff that were in hospitals, working in the hospitals, not enough staff, people working probably longer than they would have to generally work, hours per day. But COVID-19 has really put the spanner. But I do agree that the NHS here, we have difficulties here in Northern Ireland. We have difficulties with waiting lists and getting operations carried out and getting to visit consultants. I do believe that we're in a better space than what the Republic of Ireland is in at the moment, because I hear some stories and I have relatives down there who would tell me some difficult stories as well, and they would say to me, we wish that we lived in Northern Ireland. We have some good services here. We have no problem in supporting the good work, the cross-border cooperation that goes on in healthcare. As you quite rightly mentioned, the cancer care from Galvin and the children's heart operations in Dublin, we totally welcome that there. And overall, we would not support an all-Ireland healthcare service. We do have issues with it. One question I would like to ask you is, how would this all be funded? Or who would fund it? At the end of the day, would the funding be per head of capita? When you look at Northern Ireland, roughly 1.8 million, and you have about 5 million of a population in the Republic of Ireland. Generally, if we went down the road of per capita, I would always find that the lesser numbers would get less, and the country with more would get more. So I do think there would be a feeling there. But unfortunately, as I said, we agree totally with cross-border cooperation on healthcare. We have no problem with that there, but just we do not support all-Ireland healthcare.
Thank you, Alderman Devaney. Now, there is a question there, but I think, if you don't mind, we'll take all the speakers first. If the deputation's happy with that, we'll take all the speakers first, and then, rather than having you coming in and out, and then do the questions at the end. Is that okay? Councillor Harkin.
Thank you, Chair. And again, like all our councillors and aldermen, I want to welcome Conor and Alan today, and thank you for your presentations. And I think in the pandemic we've seen that very clearly that public health systems have proved themselves to be much more superior to privately run health systems that are clearly geared around primarily putting profit at the centre of health, whereas public health systems are about putting care and taking care of people at the centre of their purpose. So I think that here in the north and many other places that have national health systems services, I think we've all had an awakening about the need to protect the health service and try to expand it. If that wasn't already clear, and it was clear to many of us before the pandemic, because we've had growing issues with staffing issues, funding cuts, increase in privatisation, kind of in a slow creep rather than all at once. But I think there's been a spotlight put on this here in the north, because I do think people love the health service. People love health workers, but we all know that the health service has been under a massive strain as well. So I think what the pandemic has done has made it clear to the vast majority of people why we need to defend it and protect it. But in the south as well, I think people look north and they say, we want a health service like that. People don't necessarily see all the issues with privatisation and the hundreds of thousands of people on waiting lists here in the north. What they see is a system that is designed to be from the cradle to the grave, free at the point of delivery. And that's a positive thing. And as other people have said, that doesn't exist in the south. You have a two-tier health system where if you have a lot of money or access, you can get the best health service If you don't, you're on long waiting lists. And the danger for us here in the north is that that's the direction we could end up in, or end up going in. So I think that the idea of an All Ireland health service is about protecting the NHS in the north and then creating one in the south and actually bringing all them resources together that says then that people's health should come before profit, and we actually need a collaborative system that can deal with things like pandemics, as we've seen. And I think that the argument for this, I think, is being made by the pandemic, where we've had divergent policies north and south between Derry and Donegal, and I think on an island of our size, where we can actually take preventive measures like New Zealand took, to reduce the threat of a pandemic. But that will only happen if it's done on an All Ireland basis, where there's increased collaboration. And so, as other people have said, there is so many examples right now of excellent cross-border collaboration, and I think that should be the model and really what we focus in and try to build on. So thank you again for your presentations.
Thank you, Councillor Harkin. Councillor Barr.
Thank you, Chair. Thank you, Alan and Connor, for an excellent presentation. I have to say, I couldn't find anything in that presentation that I would have disagreed with. The key points: healthcare is a fundamental right, and healthcare should be based on medical necessity and not the ability to pay. I find the health service here and across the borders creeping steadily towards the American system, where only the rich can afford to be treated. To me, the present system here is not fit for purpose. The privatisation of nursing homes was a perfect example. Nursing homes here deliberately held out on purchasing PPE because they knew eventually the government or voluntary agencies would step in. Despite all the warnings, they failed to prepare properly. It's all about profit. The recent scandals in nursing homes, one right here in Derry, are the consequence of a flawed system. I'll be fully supporting and advocating for this system. Thank you once again.
Thank you, Councillor Barr. Councillor Donnelly.
Yeah, thank you. Thanks for letting me in. Not a member of the committee. A lot of what I was going to say has already been touched on by some of the colleagues here. But look, I think the reality is that we're living on an island. The island is too small. Not only, and I think there's absolutely no doubt from my perspective that partition has failed. It's failed the people of this island and has done so for 100 years, and as long as it continues, I believe that it will. And it's not just the health service. We have the education system, housing too, and I'm hearing people pointing out some of the flaws of down there or whatever. Look, there's when we talk about an All Ireland health service, it's very important to remember that it's not taking what we have in the 26 counties and extending it into a 32 county situation, nor is it even a matter of taking the health service in the 6 counties and making it become, fitted into 32 counties, because there is serious issues with the health service, and a lot of them have been very clearly put forward here. The ongoing privatisation, the huge waiting lists, that deliberate run it down by the Tories, and there is a lot of people who are sitting at this minute in time because of the waiting lists, and they're in pain. And this isn't the 6 counties. This isn't the NHS. Only the other day, an 80-year-old woman from Bogside phoned me and asked her to find out how much it is to go private to get her cataracts done, because she didn't believe she has long left on this earth and she doesn't want to go blind. Do you know what I mean? When you're hearing that, then there's serious issues with the health service, and I'm sure everybody in this room could give a testimony similar to the one that I've just outlined. So I think it's definitely an idea, and I think it's important to remember it's not stretching one into 50 hours. That it has to be one that's free appointed delivery. It's available to everybody who requires it, because this is people's health that we're talking about here. And listen, I'd like to thank Connor and Alan too for their presentation. Thank you.
Thank you, Councillor Donnelly. Councillor Logue.
Thank you, Chair, and thank you both for your presentation. Look, I will knock over what our council, my colleague here, has gone over. We're fully in support of your campaign. And as you've heard, we've been campaigning not only for an All Ireland Health Centre, but an All Ireland. I would just like to, I suppose the first point I would like to make, it's regarding a couple of comments that have already been made here. And the first one would be the one made by Alderman Devaney. And we've heard it being peddled out here on a number of occasions, the fear that if you get out, if the, you know, the people living in the south are resentful of the health service that we have here. That's okay. While we have to admit that not everybody in the south gets health free at the point of delivery, but hopefully when this country is united, our policy is that health is free at the point of delivery for everyone. But there is a myth being peddled here that everybody is paying for their health care in the south, and that is simply not the case. It's not. Those who have long-term health conditions, I have relatives living in the south who get free health care. Their children get free health care. And I would like to say there's some parts of that health care where it's even enhanced to what we would have here. So we really need to be getting away from that myth that everybody has to pay for health care at the minute. But as I said, when this country is united, health will be free at the point of delivery for everybody. Also, I heard it mentioned about the two-tier system in the south. We have a two-tier system here. It's been here for a long time. We all know those who have money can pay for their health care, and that's simply not fair. Just to pick up what Councillor Donnelly said about a constituent having to wait. That was one of the good things about being in the EU. We could apply to other countries that are in the EU to go and have that treatment. Sure, you might have to pay for it up front, but it could be claimed back. So that's another thing which we are going to have to face now, that our citizens here are not going to be able to access that service by leaving the EU. So that's all I would like to say. Thank you.
Thank you, Councillor Logue. There was a few questions. I think Alderman Devaney, and do you want to answer them now as part of the deputation? Go ahead, Councillor Ward.
I think there was one question. What I heard, it was asked by Alderman Devaney here. Where are you getting the money for this here? Because basically, in my eyes, Northern Ireland, we're the best part of the UK. We have one of the best healthcare systems in the world, the National Health Service. Now, when I look at down south, yes, Patricia's saying, oh, there's not everybody, but there is. 60% of people are paying an average of £52 to go and visit a GP. Over £144 or euros, sorry, per month on medication. Now, it's very good on the presentation, but where's this all getting funded, as Alderman Devaney stated?
Okay. Okay, I think that concludes the questions and the presentation. Connor and Alan, thank you very much for coming in to do your presentation today. That was very interesting, and thank you. Okay, we're going to move on to Chairman's business. There's a few items of Chairman's business. Just one point I'll make myself, I suppose, as we have a few members here who aren't actually members of the committee, and we would, I believe everybody's voice should be equal and given an opportunity to speak, but obviously we have a big agenda here, and if everybody can keep their point as brief and as to the point as possible till we get through the meeting, I have no problem with anybody speaking, but we have 30 items to get through, and the length we're here will be determined by yourselves. So, Councillor Edwards was the first person to come to me for Chairman's business. Thank you.
Chair, thanks for letting me in, and I'll try not to take up too much time. I just want to raise an issue, Chair, that has brought to my attention by Science Plus Football Club, and I do recognise, and I spoke to Karen McFerrin about it, there's a bigger scheme of works going on with council in terms of changing facilities, but concern has been raised about the lack of playing facilities for youth teams, especially on a Saturday morning. The Northern Ireland Boys League kicks off at 11 o'clock, but what I'm hearing is that there's a lack of facilities across the council area, including the arena, Melbourne, and Meadows and Strabane, which is unsuitable. So I'm wondering what I know that council officials are engaging with Science Plus around trying to get a workaround. So I'd appreciate if we could get an update on that, Chair. Thank you.
Thank you, Councillor Edwards. Are you able to give us some of the data? Yes.
Through yourself, Chair. I'm not quite sure in terms of an update. Is it an update in terms of access to facilities at the present time for competitive fixtures? Is it training? Is it changing facilities? I'm not. Just give us some of the details, and is it for that one particular club?
Yep, through the Chair. It's competitive fixtures for the Boys League on a Saturday morning. Kickoff is 11 o'clock. The arena in Melbourne give priority to men's teams. So these young, the club Science Plus are having difficulties in their oppositions agreeing to later dates, like say for 12:30 kickoff. They're insisting on 11 o'clock kickoffs. So I'm aware that they have engaged with. I think officials have been speaking to the club. They says they're working on a workaround. but they had heard nothing back on it. So I'm just wondering if there is an update on it. Thank you.
Through yourself, Chair, just in terms of members will be aware in the current environment with regards to COVID, um, only one team is allowed on a facility where if you look at an example, Melvin 3G facility, you previously could have put three different teams on at the one time. The current regulations as per executive, Sport NI and the governing body are only one team at a time, training 15-minute gaps to give the staff an opportunity to get in and clean. So obviously that is reducing the capacity of both training and competitive games. Melvin Arena is currently a construction site as well, so that puts further pressure on that senior teams would use it. So we're trying our best to maximise the facilities, but there's probably not a club in the district that hasn't been impacted through COVID with regards to training and match facilities, just simply because we don't have the capacity, and we're expecting further restrictions today or tomorrow, and they're presently set at 30 people on a 3G facility at any one time, where previously we could have put 90 on. So every club in the district, we've got feedback, is facing the exact same scenario, and what we would ask is that the governing body, the AFA, we've asked for different kick-off times, different days, and they haven't been very flexible with regard to that. So our hands are tied, and so are the clubs, if they're saying that the times have to be that they previously had. So we're working with the clubs, but we're not in a position to be able to say here's another extra pitch for training our games anytime soon until we have a comprehensive capital programme agreed. So just asking the clubs to bear with us, but it's something really it's outside council's control.
Okay. Okay, Councillor Edwards. Yep. The second person was Councillor Duffy.
Thank you, Chair, for allowing me in. Just two things. The first is going to be really quick. It's just in terms of the Community Crisis Intervention Service. I would like to propose that that comes out of confidential. If that's okay.
That now. Do we need a proposer and seconder? We bring the crisis out of confidential. Councillor Lug.
Thank you.
Have a seconder?
Patricia, second.
Okay. Thank you.
So then my second issue is around it's around the 4G masks that are in the Glengalia Road. Seamus, I have been corresponding with yourself around it since probably yesterday evening when a video was circulated in social media. Unfortunately, the video has caused a lot of alarm and it has caused a lot of fear in the local area, particularly around Cairn Hill, particularly around a number of houses where people were actually knocked at their door and told that these masks were causing them great harm. A number of illnesses were attributed to the masks that the people who were living in the properties had. I would like, and I know that you have sent me information, and the information has been really useful for myself, but I think in terms of getting that information out to the public, I think that it would be really useful if Council itself would do some social media around the issue of the masks, the research that has been carried out, the information that has been published regarding their safety and regarding the radio waves that are emitting from it and how dangerous they are to local people or not dangerous as the case may be. I think that if that information comes from Council, I think that that would be really useful to get as wide a reach as possible in terms of the community who are now very frightened in terms of the video that has been circulating.
Okay, Councillor Duffy. Councillor McHugh was the last person with Chairman's business.
Chair, it's just regarding the email that was sent out to councillors through the Mayor's office regarding the update to GP services. I suppose, first of all, I'd like to say just that I commend our GPs and indeed their staff who, despite coming under increasing pressures day and daily, not least due to the current COVID situation, deliver a sterling service right across the city and district. The guidelines that are currently in place, I'm sure other councillors will have experienced this in their own respective areas, but despite these guidelines about seeing a GP being put in place, the reality on the ground is that I am finding that people are finding it increasingly difficult to get face-to-face consultations with their GP. And I think that then is having a knock-on effect in terms of conditions that people may have that are not being detected. And people are finding it so difficult to get a face-to-face consultation, that they're going straight then to A&E, whether it be in Derry or Enniskillen. So that's then is putting increasing pressure on our medical staff there. So bearing that in mind, Chair, I'd like to make a proposal that we first of all invite representatives from the BMA. I'm not sure if it's the BMA or the Royal College of GPs who would be best placed, either of those, to come in here and maybe present the Council on that specific issue of GP services, and also that we write to the Minister of Health to explore or to see what more resources can be offered or what can be put in place to better facilitate our GPs being able to meet patients face to face. Thank you, Chair.
Okay, folks, we've had a proposal there from Councillor McHugh. There'll be a seconder. Councillor Logue. Okay, we'll see if we can get that action, Councillor McHugh, and I just concur with everything you've said. I think you're absolutely right. The GPs they do a good job, there's no doubt about that, but it's virtually impossible to get an appointment with a GP in our own area, and I think some people are choosing not to go because they know they can't get the appointment, and it could be detrimental. Sorry, yes, go ahead.
Thank you, Chair. I was just discussing this last night with my wife, who is a local GP. She just raised that last night when she came home from work about 7:30 last night, and I can say that yourself, Chair, and the rest of the members, she is deeply frustrated with the current crisis in the system and at the current present time, because she knows that her patients are getting reduced services, and because of the regulations they have to implement with social distancing and things like that. And she herself was actually quite adamant that she said, could like a local delegation of GPs come and address this forum, because they are quite adamant that they would like to, offset or lay anybody's fears, because they want to see their patients, they want to engage, but because of the regulations involved at the current time, and with their own staff and health centres, they have to obviously comply with regulations as well. But she said to me just to pass on, actually, from Councillor McHugh's proposal, that they would quite happy to try and get a delegation as well. They want to come and present to the committee, just for they present and they show the members here of what they want to do and how they want to re-engage with their own patients and services. But that's just a thought if you want to follow up at some stage anyway. Thank you.
Thank you, Councillor.
That's a proposal, obviously, if anyone wants to second.
Sorry? Can we include that into the proposal? Is everybody happy if we include that into the proposal of Councillor McHugh's proposal? That we incorporate that? Taking it that's a yes. Alderman Devaney?
Thank you, Chair, for allowing me in, and I fully support the proposal here. I think any of the members in the chamber here and even in the council have the same problem arising across the whole council area. It is a worrying situation that you have constituents or people out there who are worried about their health, and look, there are many people out there who are lastminute.com, and in those situations they're finding it difficult, and a whole range of health issues is finding it difficult getting a face-to-face with a GP. And what I'd just like to say is I support the proposal here, and I do believe it'll be important that we bring them here and have a discussion.
Thank you, Alderman Devaney. Councillor Logue, do you want to come in?
I just want to say I think that would be useful if the local GPs do come in. I think there is a vast inconsistency of the way some GP surgeries are working at the minute, some better than others, and I think communication is a big issue to their patients. But as well as coming on here, like, they need to be making representation to their overarching body that they can work in a safe environment, and so that things can be changed. But there is, I would just like to concur, there is very, very serious concerns here, especially within the day it's in it. It's World Suicide Day today, and we did hear Siobhan O'Neill from the University of Ulster on today, and I think she was on yesterday too, regarding the decrease in the amount of people getting access to services. And a lot of the access to services is due to their access to the GP. So there needs to be smarter ways of working. There's a deep fear out there too that this new way of working is going to become the normal way of working, and that's certainly not acceptable. We have a vast older population here which is growing, and they're really not on the digital communication. So there are a lot of issues. I'm not going to hold this meeting up, but the more people that come in here and listen to them, the better. Okay, thank you.
Thank you, Councillor Logue. That would seem to be the... Oh, Councillor Rory, Councillor Farrell. Sorry.
Thanks, Chair. I had tried to signal to you when Councillor Duffy was speaking about the masts in Cairn Hill, because we too have been contacted by concerned residents. So I did want to speak on that. But what is the agreed action on that? Because I think I've received email from Health and Communities as well, because we had contacted this morning. I think the residents in Cairn Hill need reassured that there's nothing untoward coming out from those masts. I'm not sure if it's council's remit, but what would be helpful would be that there was some sort of test done down there, because there's a YouTube video saying that, I'm not going to repeat it, but people are scared, people are worried about these masts, and I think we need to reassure them to say that you're safe living there, because they're panicking. And there's people putting these videos on YouTube. I don't know who the hell they are. I don't know what qualifications they have. I don't know what equipment they have. But we need to reassure the public, especially the people in Cairn Hill. So it would be useful if we could understand the action from council, but my view would be if we could organise some sort of test that can be pardon my French, that could be verified to let the people know that they're under no threat whatsoever living in the vicinity of those masts. Thanks.
Thank you, Councillor Farrell, and sorry I missed to bring you in on that. Councillor Donnelly was looking to come in.
Thanks, Chair. Chair, I haven't seen the video, but I can imagine what type of video it is. Do you know what I mean? But and there probably isn't anything in the video. Do you know what I mean? But it doesn't mean to say that it hasn't caused concern amongst not only the residents in Cairn Hill, but there's a school in Cairn Hill too, and that has children from throughout the city. So even for maybe some of them children who would be going to school and maybe getting anxious or have concerns, I think that the people who do this type of thing need to be, they need to catch themselves on and the worry and the damage that they can do. Thank you.
Thank you, Councillor Duffy.
Yeah, I just want to second Rory's proposal there in terms of if there is something that we can do to test it, absolutely we should. And I understand your frustration in terms of the bloody comment, because I've said a lot worse over the last couple of years. So no, absolutely, if there's anything that we can do in those lines. But initially, I think it is important that we get some sort of information out to people, because there are people who are very scared and very worried at this point in time.
Councillor Duffy. Oh, sorry, Councillor Harrigan.
Thanks, Chair. Yeah, I don't want to belabor this point, and I was planning to raise this at another point, but we're talking about it now. I hadn't heard about this video, and I'm glad Councillor Duffy has raised it. Now, there's been a series of rallies held in the Guildhall, COVID scam rallies, which are similarly, I think, creating a lot of fear and confusion. Now, there's all sorts of ideas about about masts, about the pandemic, but there is dangerous stuff at these rallies, and I think as a council we should be condemning it. At these rallies, essential workers, I'm talking about nurses, care workers, bus workers, and teachers are being described as agents of the state for encouraging people to follow guidelines. Health guidelines, that's what they're being talked about as, agents of the state that should be targeted. And then anybody that wears a mask is being described as a sheep or a slave. This is, I think, dangerous stuff, and I think we should be not encouraging this. And it's worse than that. if you listen to some of these videos, they're talking about the Illuminati being in control of the pandemic. Now, the Illuminati, this is one of the oldest anti-Jewish, anti-Semitic conspiracy theories, and I think as elected representatives we should have absolutely nothing to do with this nonsense that's being spouted. Now, the people that are supporting these things across the island, before the pandemic they were promoting anti-migrant, anti-LGBTQ, anti-women, anti-choice ideas, and they've leaped onto the pandemic and they're pumping air into all these theories about masks and 3G and 4G and microwaves and about essential workers being agents of the state. And I think we should have absolutely nothing to do with it. And I think we have to, as political parties and representatives, I think we have to take a strong line in this.
Thank you, Councillor Harkin. Oh, sorry, Councillor Logan, you know.
To come on again, but just on that point that Councillor Harkin has raised too, I had a phone call from a very, very concerned head teacher at the start of the week where her staff were approached by 5 men, very intimidatory, to the school, coming from the said organisation and saying, and then advising the principal that they were personally responsible for for any health issues that goes on in that school. So they were looking for them to respond. So this group of people, whoever they are, they're using very intimidatory ways of among the citizens of this council district, and it really needs to be nipped in the bud. So we'd just like to have it on record that it's not acceptable for people, no matter what group they come from, to go into a school and try and impose their views on vulnerable staff.
Thank you, Councillor Lowe. I think that concludes Chairman's business. We're going to move on to item 7, which is matters arising from the open minutes of the health meeting on July the 9th. And just checking them for accuracy. Is there any pages 1 to 22? Is there any issues with the minutes? Taking it that's a no. Okay, that leaves us moving on to waterside or matters arising. Any matters arising out of the minutes? Okay. Councillor Wark, or Alderman Wark, seconded. Okay. Shared space, Barry.
Thanks, Chair. Members, the purpose of this report is to invite your views on the progress of the Waterside Shared Village project and receive a presentation from 2 of the members of Health and Community staff, Keith and Leanne, who will give a short 5-minute presentation and be able to answer any questions on it. And also, members, the purpose of the report is to approve a reallocation of planned revenue expenditure towards unrecoverable costs that may arise from SEUPB. Just on the finance element of it, members, this is a fully funded project from SEUPB, but Council have an associated revenue budget for this project starting this financial year of 100,000 and next year 165,000. It's proposed that we use this revenue budget for any compensation events in the capital project that are not covered by SEUPB. Now, none of those have arose yet, members, but we're just seeking your approval if that is required and SEUPB don't have any additional monies to provide, that we use that revenue budget going forward this year. So I'm going to hand over now to Leanne and Keith, who will give the presentation and be able to answer any queries on it.
Sure. Councillor Mooney.
Thank you, Chair. And thank you to the officers for a very comprehensive presentation on this super project tying in the two areas of Godman Scale and Mary Street. I note that from the presentation, the letter of offer came out in December 18, and I know Covert has intervened in the moment and has put things back. But just wondering, is the contract award still online for the end of the month? Is that still on track? Yeah. And I note as well that it's got a lot of shared facilities and things like that there. But what was one more point I was going to raise there? But I do adopt what you're saying, and I thoroughly congratulate you on your progress so far for this project. Thank you. Thank you, Chair.
Thank you, Councillor Mooney. Have any other questions before we let the deputation go? Councillor McHugh.
Very good, Chair, and thank you for the presentation. My question's a follow-on from Councillor Mooney's. I'm glad to hear that the contractor is still, or the timeline for him to be, or for them to be appointed, still on track. So is the delivery date or the completion date, sorry, is it still on track for the project to be completed? Thank you.
Chair, I suppose just to come in there in terms of this is a design and build project rather than a traditional procurement that we normally manage all of our capital projects or have done to date, and it's probably in relation to the nature of the funding, and it's European funding and SEUPB. So look, it's probably not just as definitive, but as Keith has highlighted, we probably, because of the extensive consultation, the revenue programme that has been ongoing, there's nothing, any surprise to any of the community out there in terms of what the facility is going to look like, and also in terms of the residents. So we think, Councillor McHugh, that everything will be on track, subject to any unforeseens. Just, Chair, we also have a recommendation in there around the proposed reallocation of the revenue spend, so we'll need a proposer and a seconder for that recommendation.
Councillor Mooney. Wait a second.
Just also, as behalf of the DEP, we think it's an absolutely outstanding project coming in that area. Obviously, there used to be the old Clondermott High School, and then with the shared future centre there, but it's going to be a really good safe space for everybody, all the residents around here, especially on Godman Scale and Airy Street. But a very good job done by the officers there. Thank you.
Thank you, Councillor Alderman Ward. So, that's everybody. We can let the deputation go. Thank you very much for coming. That leaves us moving on to point 9, COVID Community Support Fund, and Barry.
Members, this report builds on, there was a bit of discussion at last month's committee around grant aid and more allocations from DFC. So the purpose of the report is to seek your approval for the allocation of funding provided by the Department for Communities in response to the COVID crisis. Members, you'll be aware that the Minister's announced a further allocation of COVID Community Support Fund to be distributed through our councils, 1.75 million additional allocation to the COVID-19 Community Support Fund, which we're looking decisions on today, $750,000 COVID-19 Access to Food Fund, and 700,000 for the COVID-19 Financial Inclusion Fund. We don't have letters of offer for our council or any other council for those two second awards, but that's something we're anticipating in the next number of weeks, members. In terms of this council, we've been provided with a letter of offer for 280,950 for for the second tranche of the COVID-19 Community Support Fund. We have already made a number of decisions of what we would use this for, members, but I'm just going to go over those again. In July 20 this year, members approved an allocation of 20,500 to be prioritised from any additional funds to extend the Community Venues Fund for the final 3 months of 2021. Members also approved an allocation of 101,253 to fund all applications to the Community Support Fund who had scored over the threshold, and this additional finance to be subject to an additional COVID-19 Community Support Fund allocation, which we now have. It was also agreed that any additional COVID-19 Community Support Fund allocation, after provision has been made to the Venues Fund and the additional Community Support Fund as outlined above, would be allocated to the local growth partnerships to prepare local COVID-19 recovery plans. Members, you'll be aware we previously had our COVID-19 response plan, so we're proposing an allocation towards recovery with regards to this funding. So in terms of the finance around it, members, the Community Centre Venue Fund allocation of 195,000 is available within our directorate budget allocation for this financial year, and the total annual cost of this fund is 215,500. An allocation of 161,625 has already been allocated to provide extension to December 2020, so a further allocation of 53,870 is required to extend the programme to March 2021. Total of 33,375 is already available within the current allocation, and so as I've highlighted, an allocation of 20,500 is required from this additional fund. An allocation of 214,500 for the Community Support Grant Aid is available within the current directorate budget. The total amount required to fund all applications scoring above the threshold is 315,753. So the additional allocation of 101,000 is required and is now available within this additional resource to fund all applications. In addition, the above allocations, a further 159,196 is available from the second tranche of this COVID-19 Community Support Fund for an allocation to the 8 local growth partnerships. So members, in terms of recommendations, that an allocation of 20,500 to the Venue Support Fund, an allocation of 101,253 pounds to fund all Community Support Fund applications above the threshold, and an allocation of 20,000 each of the 8 local growth partnerships to prepare and deliver COVID-19 recovery plans.
Thank you, Barry. Is there anybody looking to comment on this? Were you looking to speak, Councillor Burke?
Thanks, Chair, for letting me in. So we'll be supporting the report. There's no doubt that the COVID crisis has left a long-standing legacy in terms of, in a number of aspects of people's lives. It magnified more so than ever the issues that our communities face, particularly around mental health, well-being, poverty and food poverty. And I think the knock-on effect and the repercussions of COVID that it brought and continues to bring is something that we need to address strategically. So, and then in terms of the Community Support Fund, the community venues, support and resources need to be made available to these groups and services within the area so that they can be guilded, obviously rebuilding the communities and working in the community sector. I see firsthand the great work it's done under both community support and community venues, and I think that it's vital that these projects are here and they're needed now more than ever, so we're happy to support it. Thanks.
Councillor Burke. Alderman Devaney.
Thank you, Chair, for allowing me in. And like the previous speaker, the DP has no problem in supporting the recommendation here. We welcome this money from the UK government in here to help, and we all know the broad range of issues around COVID-19 and the issues, and it's important that this money is now divvied out to those groups that really need money to keep them ticking over. But I would second that recommendation if there was a proposal from the Did you propose it? I'll second it.
That's okay. Okay, Alderman Devaney. Councillor Donnelly.
Thanks, Chair. Chair, there was a lot of good work done throughout the whole intense period of the whole issue over COVID. A lot of people stepped up to the mark and put a lot of work and effort in. and there's also people out there, and I'm sure Barry would be aware of this, who are either unwilling or unable to work with the structures, but however, they're very much part of this community in every aspect of it, and are also ratepayers and taxpayers. Has any work been done to try to include them people in some of this structures that's happening?
Through yourself, Chair, Gary, we just received a letter of offer. We haven't consulted with anybody really in terms of the some of the money or the majority of the money is just going to be given out to groups that we had already agreed. In terms of those groups over the threshold for the community support fund, that open process we had, and also the venue fund as well to continue that for the rest of the financial year. The recommendation here is to go through our existing structures of the local growth partnership. So have a responsibility of council officers and those growth partnerships to engage fully right within their communities and the DEAs that they're in, including Strabane Town, to try and be fully inclusive of those groups. I'm not quite sure if all of the recovery plans have been developed as yet. I can find that out, in terms of from the officer team. I know that our officers have been working with those groups, looking at recovery plans, so that's something we can find out and to see what those recovery plans actually look like. They will actually be brought in here for approval as well before any spend was agreed.
Thank you, Barry. Councillor Harkin.
Thanks, Chair. Thanks, Barry, for the report. And yes, I think that, look, any funding is more than welcome. We know that it is desperately needed. And right now, we do know that the UK government is actually cutting back on a lot of the relief funding. They're talking about getting rid of the furlough scheme. That will have a massive knock-on effect in the communities. It'll make more people food insecure, as it's called these days, and then it's going to have a knock-on impact in terms of fuel poverty, because we're going towards the colder months as well. So, while the funding's welcome, does it add up to what we actually need? Because it looks like a lot of money, but when it's all distributed, how much more would we need, I'm asking, to actually meet our goals? So that's one thing. And as Councillor Donnelly says, there was a lot of brilliant work done by many organisations and volunteers through the resilience programme, but there was also some frustrations, which is why I proposed we do an assessment to see how we could incorporate everybody that was pulling in the right direction during the worst of the pandemic. I still think we need to do that and look at everybody has seen the headlines today about a spike in terms of infection, so we can't rule out that we'll be unfortunately in a similar situation at some point. So I think we have to be forward planning about how to be as inclusive as we can. And then there's groups like the Eglinton Community Hall that are having to do a public fundraiser right now, and they played a fantastic role during the pandemic in terms of food box distribution and everything else. So I would like to see organisations like that. Maybe is there a way that we can make sure that they get helped as well? We want them to keep their doors open because they played such a vital role, not just during the pandemic, but during the flooding and during many other. They're a real glue out there, and that's an example of, I think, of an organisation that is maybe. There's many organisations like that maybe aren't as directly linked into the resilience plan that we should be looking to involve and help and make sure they're properly funded. And the goal at the end of the day is to make sure communities are as resilient as possible.
Thank you, Councillor Harkin.
For yourself, Chair, and probably to answer for the point of Gary's, you'll see in the first page of the report as well, members, that there's a 750,000 access to food allocation. That's to be split across the 11 councils. Now, speaking to some of our other council colleagues the other day and DFC, we see this maybe whatever allocation being given out to food banks, to try and assist and bridge the gap. So, and that probably links into your question, Gary, in terms of food boxes, and then back into Councillor Harkin's question. That could be 75, 80,000 to this councillor. It won't be a whole pile. It'll be money that'll have to be spent by the end of financial year, and we don't know what that target and what funding will come in from next year onwards. But so it's not a lot. But again, trying to answer your question, Councillor Harkin, with regards to helping groups out there. The majority of this money will be used to deliver our own council services, to be able to fund the groups that have applied their grant aid that scored above 65% to continue with their venue fund for the rest of the year. And then, as I've highlighted, put 20,000 per DA into recovery plans. Will that be enough? I would doubt it. If you even seen the amount of food and boxes and other support that went in during the COVID crisis, so it'll be up to each of those areas to prioritise what they want to do and bring it back in front of this chamber. But from speaking to people, it could be things like summer camps weren't run, youth older people's programs, so they might try and resurrect those programs over the winter period to try and put a bit of money into it. But you've highlighted the ongoing crisis. If we're in some sort of lockdown mode again, will those go forward as well? So that's something we'll bring back in front of the chamber members. But to answer your question, we could do with the same money again, probably 3 times over, to try and mitigate the impact of COVID. But we'll try and do the best on what we have with the letter of offer we have.
Thank you, Barry. So, well, if everybody's happy there, we'll move on to point 10, UNICEF Child-Friendly Cities and Communities update.
Members, this is quite a detailed report with quite a few appendices, so I'm just going to be very short with this. So in terms of the purpose, it's to update members on the UNICEF Child-Friendly Cities and Communities programme. We're looking member nominations for cross-party and independent political representation to become UNICEF champions. That's a mandatory programme requirement. And to seek approval on the 3 optional badges and 18 outcomes co-designed with children and young people and adults across the district, and you'll see those within your appendices, members. So we're seeking your approval for what's presented in front of you, and also nominations to be UNICEF champions from each party and one from the independent group.
Okay, can we take the nominations from the group leaders?
Chair, I'll propose Alderman Warwick from DP.
Councillor Farrell.
I'll propose Martin Riley from SLP.
Councillor Duffy.
Happy to propose the report, but also to propose Aileen Mellon as our representative.
Councillor Ferguson.
Thank you, Chair. I'm just going to propose myself from the Alliance, Barney.
Okay. I think I propose Councillor Guy, seeing he's not here. Our Alderman. And Councillor Hargan.
Thanks, Chair. I'll propose myself for People Before Profit.
Okay. Is that everybody?
Chair, through yourself, we'll also need a nomination from the independents. So I don't know if you want to defer until full council.
Councillor Barr or Donnelly, have you?
I propose Councillor Carr.
He can't.
I can't propose it. Need to be Councillor Barr.
I propose Councillor Carr.
Councillor Carr is duly proposed. Is that okay, Barry? Yes. We can move on to point 11, 3G maintenance spraying.
Members, the purpose of this report is to seek exception from Council's stated policy position on the use of weed killer as a method of controlling weeds and artificial sport services. Remember, you should be aware of the number of 3G facilities that we have and new ones coming on stream that within our capital development portfolio. Members previously took a decision at the ANR committee to cease use of weed killer in particular products. At present, there's a real serious issue in encroachment of weeds across several of our 3G services, and if this isn't managed effectively, these weeds are going to take root and damage the carpet from the base upwards. The manufacturer's guidelines for the 3G carpet and all these pitches require that they're all kept weed free, and indeed you'll see in section 3.3 for those facilities where there's a higher standard of football played, like at the Ryan McBride Brandywell Stadium and the Felix McCrossan pitch, those accreditations have to be kept, and if weeds are not kept under control, those accreditations could be in jeopardy. So members were seeking approval for the use of weed control spraying where necessary to maintain the surface and protect Council's investment in our 3G facilities.
Proposed from Alderman Devaney and seconded by Councillor Logue. Oh, sorry, you want to speak, Councillor? Yes, okay. Okay.
Thank you. Thank you, Chair, and thank you, Barry, for this report. Our party cannot support this recommendation. It was myself brought on a motion to Council regarding the use of weed killer, especially glyphosate. This glyphosate and especially been used in where there's going to be contact type persons with the facility. Certainly, we see this as a step back. Council must invest in other ways of and other equipment that deal with weeds. I know a report was to be brought back on the full cost of that equipment. It was like hot water suds and that, but certainly from our perspective, we as a party cannot support this recommendation.
Okay, thank you, Councillor Logue. Did you want to come in and speak on that, Alderman Devaney? Yes, Chair, thank you for allowing me in. I come from a farming background and I understand weed control and I understand the difficulties here, but we're caught between a rock and a hard thing here because if we do not spray these areas, there are serious costs to replace carpets. And I mean, I've been involved in costings and around carpets and I've heard prices 50, 60, 70,000 in excess in Barry, and you would probably know better than me the cost of replacing them. And I believe, look, in these areas where we need weed control, we need that type of weed killer to protect the carpets in those areas. As long as it's done safely and in a safe manner, I know I wouldn't have a problem with it. Thank you, Alderman Devaney. Councillor Mooney, did you want to come in?
Chair, I was going to come in there, but I think I was sort of superseded by Alderman Devaney's sort of remarks here. But on that note, what I was wondering was, if you use weed killer, do you have to close any of the pitches or for any period of time that the weed killer settle or things like that, or what's the health implications for users if there was any?
Yourself, Chair, it's our grounds maintenance team within ERNR do that, but it is my understanding I think you have to close it for 24 hours at least if you're spraying that type of product on it at least 24 hours. So all bookings and that would be cancelled if you're doing it. I'm not quite sure how often you would have to do it, how many times a year, or whatever. But yeah, it's my understanding you would have to close. So,
Councillor Logue.
Let's come back on again. Look, Chair, thank you. And we took a full unanimous decision here at this council that we would halt the use of weed killer except for the likes of Japanese knotweed and the likes. Certainly, we all know that the DFD use weed killer in our streets. They go around spraying it. Other organisations use it as well. This council would have used it. The housing executive use it. We all see that the weeds are dead, but they still need to be dug out. So are we going to use weed killer and then in the end you still have to go on and dig them out? We really need to be investing in the equipment that deals with weeds in a safely a manner as possible, and I think safety is key here. And on that note, I would ask members to urge caution on how they vote for this recommendation. Thank you.
Thank you, Councillor Logue. Councillor Donnelly.
Yeah, I was just going to say what Councillor Logue was saying, that what is the corporate position? It's my understanding that the council did vote for Councillor Logue's motion, which, as far as I can remember, calls for a ban on all products using glyphosate and for to use more environmentally friendly products. If people in this committee vote for this today, are they going against the corporate position of the council? Now, that was my understanding, and Councillor Logue has just clarified that.
Thank you, Councillor Donnelly. Councillor Harkin.
So we have similar concerns. So it's been brought to our attention, and I'm sure the other councillors, that some weed killers are being used across the city in terms of dealing with weeds that are very difficult to get rid of, and people don't seem to have another solution to that. So, is this being proposed as a one-off because these weeds will keep coming back unless they're completely dug out? So, like, was there a paper proposed, and is that being prepared about alternative solutions? Because I'm sure grounds workers are at their wits' end about how to deal with the pitches. But I think that the motion was the right motion, and then we can't keep. And I'm sure everybody knew there was going to be difficulties at the time because it's not easy to get rid of weeds. But then we have to be coming up with alternative plans. So we would share our members' concerns with this proposal.
Councillor Farrell.
I'd like to echo Councillor Harkin's query. So, the paper suggests that we use weed killer to address the weeds in 3G pitches. Is there any other technology available? I share Patricia's concern as well. So, you had said about some magical machine. Barry, could you give us some background on that? Is there any other way to do this effectively without using weed killer?
Through yourself, Chair. I'm not passing the buck, but I'm not an expert on this. In terms of, I'm led to believe that maybe there'll be another paper coming into ENR around this. We have received advice from our grounds maintenance team. We have concerns in terms of property managers. Some of our pitches are in a dire state. I suppose the point I've been making to highlight to members today, that could get to the stage where if it's not addressed pretty soon, that those pitches will come out of play. So look, maybe the best thing, members, is to speak to our colleagues in ENR who'd bring another paper maybe in. They're more up to date with the technology and bring it into the ENR committee. But just to highlight to members, there is a major cause for concern in some of our 3G facilities, and the lack of the Ryan McBride Brandywell one gets a regular inspection from the FAI. So we're not saying that's at that stage yet, but there are some of our less renowned facilities that are a couple of years older that are experiencing major difficulties. So it's something we'll need to get into the NR committee sooner rather than later. So we'll speak to colleagues in the NR, members reminded to I'm not passing the buck, but they can present a bit more detail around it.
Thank you, Barry. Councillor Ferguson.
Thank you, Chair. And being in the ENR committee last year, I think the main issue when this came up before was the frequency and how often the weeds actually get treated, which is why they prefer the weed killer. So I was going to say what Councillor Farrell and Councillor Harkin said before, if we could have other options and the costings even towards that, if it's someone having to go out and put hot water and soap on it every so often versus, once every 3 months. I think we need to know that information before we agree, because I know this is a big campaign and it was a big campaign around cancer and the impact of these weed killers. So I don't think it's something we can make a decision today on.
Thank you. Do you want to come back in, Alderman Devaney? Thank you, Chair, for allowing me back in. I think Councillor Logue has hit the nail on the head that the less killer that you have in weed control, the weeds will not die. They wither for a while, but they come back in their green growth again. And I've only specified, and I want to make it very clear, it was only for the issues in around the 3G pitches, if it could help facilitate that. It wasn't opening up that we'd use the weed killer on a broad span across the council. It was only just to facilitate. And look, no matter what weed killer you spray, I think it's fair to say, Barry, whatever pitch or whatever it is sprayed, they have to be closed for 24 hours. I mean, no matter what weed killer you use. But I'm happy to have it passed on to the ENR now. I won't say it's passing the buck, but... Okay, so is everybody happy if we bring this paper, wait a paper on the ENR committee before we make a decision? Is that acceptable? Okay, thank you. Item 12, the Department of Justice consultation on policy, and that is Barry again.
Members, the purpose of this report is to provide you with a draft response to the Department of Justice consultation on policy proposals for new provisions to tackle organised crime in Northern Ireland.
Proposed Alderman Devaney, seconded by Alderman Warren. Is there anybody who wants to contribute? Okay. Moving on to point 13, Department of Justice draft organisation crime strategy.
Similar vein, members, to provide you with a draft response to the Department of Justice draft organised crime strategy for 2020-2023.
Alderman Devaney and Alderman Warren again. Okay. Item 14, Brandywell Greyhound Track.
Members, the purpose of this report is to seek your approval for reopening the Brandywell Greyhound Track to the general public with some restrictions. After the close down, members of the track due to COVID, Council have approved the reopening of the track based on the resumption of trials only, and that was in July 2020. This included admission of a one dog owner per time using the booking system. You'll be aware, members, with the exception of our selected Tier 1 leisure centres, access is controlled via pre-booked appointment system. The general public are not admitted in any other council leisure and sports facilities at this present time. The Northern Ireland Executive recently updated the legislation to limit the number of people that can participate in an outdoor gathering from 30 to 15, and we're waiting on further guidelines coming out today or tomorrow around outdoor gatherings, members. The legislation states that certain events can have more than 15 people attending, provided the risk assessments carried out and necessary measures are put in place. The Brandywell Greyhound Racing Company have submitted a proposal and an event plan to recommence racing and admit the public. With regards, members, to the public admission to Greyhound Track, the company are proposing a first come, first served basis for spectators. As I've already highlighted, our leisure centres are currently only admitting pre-booked groups and sessions of 30 or less per time slot. This is in line with our health and safety advice, and council officers don't think it is appropriate what is being proposed presently. Also, with regards to cash handling, council has taken steps to eliminate this where possible at council run leisure sites. However, based on the latest Greyhound proposal, each spectator attending racing will only have the option to pay cash on entry. Again, this is not something that officers would be in favour of. In terms of capacity, the Greyhound company is estimating that the capacity of the facility is 450 and plan to operate 25% of that capacity, in other words 112 people. This poses major difficulties in terms of safe access, egress to and from the facility. This is particularly the case as there are no plans for separate entry and exit, particularly when the Ryan McBride part of the stadium has been used for football bookings. With regards to the adverse weather planning, which we're now going into a winter period, based on social distancing guidelines, there will only be room for a very limited, and that's around 10 people under the rain shelter. The Brandywell company will be required to identify a contingency plan for the highly likely event of adverse weather. To mitigate the risk, members, it's quite possible, based on the facility layout, that council officers would be proposing that the capacity at race nights is considerably reduced, with the maximum number allowed being 10 spectators under the shelter. The remainder of those in attendance at the grounds would be racing personnel and greyhound owners. In recent days, members have highlighted around industry guidance, and council officers have been working through industry guidance rather than the governing body guidance, because the Irish Greyhound Board haven't provided any guidance, unlike IFA, Gaelic Rugby, who provided guidance around safe return to sport and activity. There is none as yet, but we have received correspondence from the Irish Greyhound Board in recent days suggesting that maybe we could return to racing with no spectators. So, members, that would probably mean, depending on the number of races, number of dogs, number of owners, personnel running it, that you would possibly have upwards of 40 to 45 people, up to 50 people, if we return to racing with no spectators. And again, we would have to manage it in and around the races in terms of that the risk assessment would be adhered to. So, members, in terms of the recommendations, that's members note and approve plans for the reopening of the Brandywell Greyhound Track for racing based on the restrictions. I would further add that recommendation, members, if the Greyhound company are agreeable based on the Irish Greyhound Board recommendation about returning to racing, with no spectators. We'll be happy to progress based on that if members are minded to recommend that, and we could try and get that going as quickly as next week.
Thank you, Barry. Councillor Logue.
Thank you, Chair, and thank you, Barry, for your report. I suppose there is a growing frustration out there within all sporting bodies and everywhere else, I suppose, where people are trying to get back to the new normal. And we understand, and certainly the situation is very fluid. There probably will be new guidelines coming out today. However, I feel that we must trust our community groups, we must trust our sporting organisations, and we as a party feel that although there's no specific guidance coming out from the Greyhound Racing Association, there is guidance regarding sporting activity, and that does allow for more than 15. We see other sports venues with smaller, and I'm not, but GAA, for example, with smaller capacity, and they're allowed up to 400. There is another Greyhound facility opened up within the north, and you know, I feel that we should be doing all that we can to try and get life back to these organisations and the people that use them. So I would be proposing that we have further, I suppose, talks with the Greyhound fraternity, but that we open. I feel that we can safely open the Greyhound facility for racing, and that should be done as quickly as possible. I see there is obstacles regarding the payment. Now, obviously, it's like everything else in life. Digital payment is not an option for everybody, and we must look at other ways of paying. I mean, shops, you can happily go into a shop and hand on £20 and get your change. You know, there's maybe a PayPal option or whatever. We must work and help the all community groups and racing groups or whatever kind of sporting groups to use other ways. We can't be leaving them to their own devices. We have to help as a council. We have a duty as a council to the ratepayers and the citizens of this council district to help them. Also on the covered area, my understanding that it can only take 10, is that 10 safely? Well, you know, if this is going to be the new normal as we go forward, we really need to, as a council, maybe invest in temporary covering, maybe for example, that can be moved around to other facilities and shared within other with other sporting bodies or whatever. We really need to be looking at this, and you know, I'm not saying put up barriers, but we need to be proactive rather than reactive to risk assessment. So I would be proposing that we open the Brandywell Greyhound facility as now.
Heard it proposed. Thank you, Councillor Logue. Have we a seconder? Councillor Duffy. Do you want to, Councillor Farrell?
Can I just ask a question about this? The Brandywell Greyhound Company, they're proposing a 25% capacity, which would say about 112 people. So is the council saying, regardless whether it's raining or not, it's 10 people, plus people that are involved in the race meeting? And if that is the case, have we spoken to the Brandywell Greyhound Company about this? You know, have they any understanding that this is 10 people, or are they working on the assumption that it's 112? is it could be that they say 10 people isn't really worth our while. So has there been a discussion about the socially distant capacity? Please.
Yep, through yourself, Chair. I'll try and answer a couple of questions there, but the last one from Councillor Farrell, yes, there has been those discussions, and quite understandably they wouldn't be happy about that, you know, in terms of those numbers. In terms of opening the facility, as a council officer, we have spent many hours due diligence in this, and I couldn't stand over just opening it for 112 people. We've had our health and safety team, we've had advice from Sport NI, we've followed the executive guidance, and I understand and probably share the frustration. The Greyhound company would like to get back to normal operation, but as a council officer, I couldn't stand over just opening it up with the present recommendation. Now, that was based the paper when it was written a number of weeks ago. The Irish Greyhound Board have now come back to say, what about opening up behind closed doors, where the personnel will be the people, the greyhound owners, the people organising the races, all of the rest. Whether that includes bookmakers or not, I'm not quite sure. Can people gamble online and things like that through that mechanism? I'm not quite sure. But if you look at the sporting advice, if it's 400 people on the ground, that includes players, it includes stewards, it includes support staff. So we would have to look at another risk assessment even if we were going behind closed doors. That would be the recommendation that I'd be making. We go behind closed doors, and we need to limit it to that 40 to 45 people for the racing personnel, dog owners, and people that are on the night for, I'd imagine it's normally around 8 races. They would have to come, and I know there are different dog owners will be there for the period of all 8 races, but that's something we'd have to manage and work with the Greyhound company. But we, in the absence of the governing body providing any guidance, like every other governing body sport have done on this island, we're following industry standard and presented in the executive guidances. We would all like to see well-designed managed sports events play their part in the journey towards a new form of normality. However, it is important that all understand the impact and implications should a local outbreak be tracked and traced back to a sports event. Liability for that will be with the facility owner, and therefore they must understand and be prepared to accept this level of risk when making decisions. And we know the demographic of people that are involved in greyhound racing and come to watch it. There are some of our older population, and at present, and back to Councillor Lowe's point, I'm not sure what the new restrictions are going to be today or tomorrow. So I don't know if the outdoor stuff is going to be further restricted. So I would be making a recommendation that we work with the company to try and look at getting greyhound racing back next week behind closed doors, based on what the Irish Greyhound Board have made that suggestion going forward. With hopefully, as restrictions are lifted, to try and start sampling and getting more spectators in. But you'll have seen even across the water, Premier League, we're talking about trial and events with spectators cancelled yesterday, and I would just err on the side of caution, members, and I share the frustration of all groups and bodies that want to get back to normal. There's nobody wants to get back to normal like the rest of us, but I would err counsel on the side of caution with this one.
Thank you. Councillor Donnelly, did you want to come on?
Thank you. Thanks for the report, Barry, and as you know, and no doubt like a lot of our councillors here, this is a community or a group that's very frustrated, and basically it's on its knees. There's a danger here, and I think it's very, very unfortunate that the current situation we find ourselves in now could has led to it being in this position, because anybody in this city knows the greyhound racing lasted right throughout our history. Turbulent times when there was no football, soccer in the Brandywell, that kept the Brandywell Stadium going. And you know, there's a social aspect and the sporting aspect of it, and it's listening to them people over the last number of weeks. And Barry, you know yourself, been constant contact with you, trying to work things out or trying to. And I accept what you're saying. You know, you're bound by the rules, but I have a couple of wee issues regarding the greyhound body and that, and them saying about going behind closed doors. Like they're overseeing stadiums in other parts of this country that hasn't adopted that position. They're spectators, as far as I'm aware, in watching our greyhound racing and that. So that causes me a wee bit of confusion. There is further announcements coming. Let's hope that there's something in it that they can take a bit of hope from it. They have 10 spectators or even less. It's going to be a loss to them. It's not going to be feasible. There's actually greyhound owners talking about, and I think some actually have got rid of it, their animals, because of the situation. Again, a point that Councillor Logue mentioned, the shelter in there can hold 10 people. Again, it's indictment as us as elected representatives and council that they're standing under a shelter, despite the fact that they had kept that whole Brandywell going right throughout everything that happened in this city. Look, get it open, see what happens, and hopefully that things will progress, and hopefully the announcements to be made might make that a bit better. Thank you.
Thank you, Councillor Donnelly. Councillor Duffy.
Thanks, Chair. And Barry, I'll just be really brief because it's just one more question. You know, I'm involved in boxing. We've been trying to do all the same and do it in a safe way. And we just opened this week, even though guidelines said we could open earlier. It's just in terms of what Councillor Logue mentioned, that there is another greyhound track in the north that is open and that it's operating. What is the difference there? Because you see, when we're being lobbied by people and we're being given examples of other tracks that are very similar to our own that are up and operational, it's very hard for us to argue why ours isn't. So is there a difference there that you can point to?
Through yourself, Chair, they're privately owned and not well, they're supposed to be bound by the same regulations as we are. And I wouldn't like to comment on social distancing at those venues, but if you look at in comparison to horse racing still behind closed doors as well, but the governing body have been firm in their guidance around that. And I suppose there's a balance here, members, as well. Councillor Donnelly has highlighted it in terms of the health of the greyhounds as well, and it's grand trialing, but the dogs actually need to be out racing. That's what they're bred for. So from the general well-being of the dogs, we need to get them racing as quickly as possible. Gary's also touched on the viability of that organisation and business if you can't have spectators, but I think certainly we should be looking at opening it and getting racing going even behind closed doors. That's still, as I've said, going to be 40 to 50 people in the venue, which is probably we're going to have to do a bit of work around risk, and notwithstanding the painting regulations coming out today or tomorrow. Gary has said the shelter would host 10 people based on new social distancing regulations. Normally that would hold up to 30 or 40 people, but just in the current environment it's not ideal. But I suppose the team have been working with the company and probably understand their frustrations more than most, and probably we are as frustrated as well, but just in the current environment that we're in.
Thanks, Chip. But you say the Irish Greyhound Board is the local greyhound organisation not governed by the ICC?
It's ICC, the Irish Coursing Club, not the IGB, but they're what have come forward with the recommendation: get the racing going as soon as possible behind closed doors at least.
Okay. So I think that's everybody. Does anybody want a 5-minute comfort break?
There's a lot of people trying to get back to normal. We're trying to, people are trying to do things to help people with their mental health and just get back to a new normal way of working. I would propose that we look at reopening the Craig Sports Centre too as well for use, especially for community groups who want to host things within their community but are unable to do so because of the social distancing regulations. But if this facility was opened, then there could be more going on within the community safely. Just to finish off, on the report too, it was mentioned about bringing staff out of Fair Road. I think as a council we should be looking to do that. People need to be back at their work, uh, uh, safely. We shouldn't be putting that up as a barrier. Oh, we need to bring people out of Fair Road. And I know there's a financial uh, a financial cost as opposed to that. But we have a duty of care to the ratepayers of this city who pay the wages of those people. And we need to be getting the employees that we have furloughed back into the workplace for their own health and well-being as well as everybody else's. So I would be proposing that we look just not at the Brandwell reopening the Brandwell racing track for racing, but also look at reopening other facilities, council facilities within communities, but especially mentioning the Craigan Sports Hall too as well, and encourage and trying to get staff back to work. Thank you.
Okay, so we have two proposals. Then we have the first one on the Brandywell, the Hound Track, and then we have the second one on the community centre. So, I have a proposal. Are you proposing both initially? So I need a seconder for both. Am I right? A seconder for the first one.
We have the second.
Oh, okay. You want to come in, Councillor Farrell?
I would just like clarity on this. So, is Councillor Lowe proposing the recommendation? Is that what it is, or is it something different? There's a recommendation in here that members note and approve plans for the reopening of the Brandywell Greyhound track for racing based on the restrictions officers have recommended. Is that what you're?
No, I'm proposing that there's recommendations there. Of course, there has to be a risk assessment, but I'm looking that, instead of the barriers that are being put up here in this report, that council officers work proactively, and that maybe see what council can do too as well, to help certain groups open, such as extra temporary shelters or whatever, or help with other means of paying. It doesn't necessarily have to be a non-cash. So I'm asking council officers to look at overcoming these barriers with the view that racing takes place again in the Brandywell, in the racetrack, and also the reopening of the Craigan Sports Centre, but all managed in a safe environment.
Thank you. Can we have a seconder for the second proposal? Okay. Councillor Burke.
Just for clarity, just on the first recommendation before we come to the Craigan Sports Hall one. So that is opening. Is that opening the Brandywell Greyhound track for racing based on previous guidelines? You know what they would have previously done.
I think the interpretation of the guidelines is open for that interpretation, Barry. So our interpretation of the guidelines would be that there can be sporting activities with 15 people or more if there is the suitable risk assessment.
Mm-hmm.
So it's not 15 people, or unless there is guidance there, and we're interpreting that it's 15 people more along with a suitable risk assessment.
Yeah, in terms of I probably should have mentioned this earlier. The Greyhound company have a risk assessment in, and we have also a risk assessment, and that's probably it's not clear enough in the report that in terms of the staff and personnel from Brandywell Greyhound Racing Company that will be in the premises, the Greyhound owners, and it would limit up to 10 spectators within that sheltered area. That's what we're suggesting. Greyhound racing could take place, or it could just be behind closed doors. We have carried out that risk assessment, and the point I'd made to myself through the chair is, as an officer, I couldn't stand over having carried out the due diligence in terms of opening it up based on what the Greyhound company have suggested to us. I couldn't present that to members to say that it would be safe following the executive guidelines.
But that's where we have that difference of interpretation, Barry, with all due respect. I mean, the understanding is 10 can safely fit within this covered structure. But how many can, they mightn't necessarily be in that covered structure. There might be no need for them to be in a covered structure at all. They could be standing out safely. And if the Greyhound committee have said to you, they have presented that they can put in 112 people safely, then that needs to be looked at. They don't need necessarily, we can't just focus on this wee shelter.
So that, through yourself, Chair, that I suppose that's the clarity I was looking for. We have made a recommendation. So is the proposal that Council adopts what the Greyhound company have proposed to Council? Is it through their plans? Is that the
as long as it's set, I suppose, yourselves. But you have to look at it, and you have to come to some sort of agreement. Like, you can't have one safety risk assessment and they have another.
I suppose through yourself, Chair, what I presented to members is myself and the team have looked at that, and that we have developed the report today that's our recommendation. So we don't agree with what the Greyhound company. So it's just to know the motion or the proposal. If you're suggesting we follow
just
that.
About the 10 in the shelter, but we have to look at the overall facility and what could safely gather there, keeping the safe distance guidelines. So I think that's a bit different, Gary, from what you are saying in the paper. I think you're focusing on the shelter, about the 10 here, and I think we have to look at the overall facility.
It's just for clarity in terms of it's that we adopt what the Greyhound company are proposing in terms of numbers for Greyhound racing. Is that, Patricia, what you're suggesting, that the Council adopt what they have said and not what our risk assessment has highlighted?
Exactly. And we also work at other sheltered facilities that could be portable sheltered facilities that could be moved about. Obviously, not obviously, I suppose, but it looks as if this COVID is going to be with us for some time, and there is going to be guidelines that are going to be with us. And I think we should, as a council, be looking to invest in portable sheltered accommodation that can be used throughout our council district, so that life can get back to some sort of normality within the guidelines.
Thank you, Councillor Logue. I know there's two more wants to come in, so we're clear on the proposal as far as Council is concerned. Councillor Farrell.
I don't necessarily support Councillor Logue's proposal. I would be happy to go with a recommendation as noted in the report and as prepared by Barry and his team. I want to see the Brandywell Greyhound track opened up again. I want to see the sport happening again, but it needs to be done in a safe manner. And we didn't want to cancel the fireworks in the city centre, but we had to. We didn't want to cancel Awakening the Walls, but we had to. We didn't want to cancel the Carnival Parade, but we had to. So I think we need to be consistent, and I feel Barry's pain here, that he has looked at this, he's obviously studied this. I can see he's getting quite frustrated about the whole thing. I'm happy to propose a recommendation. Maybe this doesn't need to be done today. Maybe this can be deferred to full council. They have another look at it, because Barry's saying 10, the Greyhound company want 112. Maybe there is scope for that 10 to be increased with a bit of creative thinking. That's my view. I'm happy enough to propose the recommendation as it is, but I think we have to be consistent in applying the guidelines. Thanks.
we have a seconder for your proposal, Councillor Farrell? Is your proposal to take it to full council?
Defer until full council, but that would give Barry and his team maybe an opportunity to look at this again to see if there could be any deviation.
So, Patricia, I forgot to ask you, were you also asking, do we scope out buying temporary, you mentioned a temporary cover or something of that description as well?
We have a proposal to take it to full council. Have we a seconder for that proposal? Sorry, Councillor Mooney looking. You going to come in, Councillor Mooney? No. Councillor Farrell? Councillor Donnelly, you're looking to speak? I know I had you on the list here.
Yeah, I just asked, look, we're in a tricky position here, see, and I would ask, you know, are we putting this back to full council so that these people have another 2 or 3 weeks of no reason? You know, that's what we're saying here. If we, you know, that's what's going to happen. I would ask people to think very carefully here. It's not what they want, but if we get the gates open and get them in, and then Barry and people can work on it, I think that's what the Greyhound people would want. They don't want just 10 people, but if we're saying let's put it away back to full council, I think that could possibly be a worse situation for them. So look, and I don't, Chair, I appreciate you're probably sick looking at me. Sorry you let me in here today because I'm not a member of this committee, but I think this is an important thing for a lot of people in the town, and I would ask people to make sure you get this right. And it could be my understanding that they may want in, even if it's 10, just and then work on trying to get the numbers up. But so I would ask people to be very careful here.
It's through yourself, Chair. If from Councillor Logue and Councillor Donnelly's point of view, if you want, if in terms of accepting the recommendation as it is today, in terms of getting racing going next week, if members are happy, also with regards to that we explore with the team also temporary covered accommodation. I don't know, what is it, a marquee or something? So it may be 10 plus another 15, I don't know, in advance of the next number of weeks. But again, Patricia, we're not quite sure what the guidelines are going to say today or tomorrow, so we could be making a decision as well and have to change it again. So we could explore that as well, Councillor Donnelly, in terms of, is there a marquee or some type of covered thing as well as getting behind closed doors, that we could explore getting some spectators in on a managed basis over the next number of weeks to give the Greyhound owners in particular a bit of hope that we're progressing with this. Maybe not all in next week, but in 2 or 3 weeks' time that may be a possibility.
Yeah, I think that, you know, nothing may change between now and the end of the month. Therefore, them number of weeks is lost, but they could be in. Open it up, get them in, and then let them keep pushing and, you know, and seeing what the regulations is. Thanks.
Thank you, Councillor Donnelly. Alderman Devaney.
Thank you, Chair, for allowing me in. And I've listened to the debate here to and fro in between. And look, I have no problem with agreeing to open the racetrack again. But I have to say, we have to go within the guidelines. And look, I think it's wrong to step outside the box of the recommendation by our Barry here, because today or maybe later this evening or maybe tomorrow, maybe this will be all scuppered, you know, with the number situation. But look, the about opening the track and allowing 112 back in again, I think we're setting ourselves a precedent here, because we're going to have, if we set that for 112, we're going to have a lot of other groups looking to get opening for 112. And while I would say is, I agree with some of the previous speakers, get them in and get them open, but behind closed doors. And the issue about, you know, looking for covers or whatever it might be, we're really setting a precedent there, because every group that opens up will be coming to council and saying, well, look, what you give Brandywell, we believe we're. So I just worry that we would be setting a precedent there as well.
Thank you, Alderman Devaney. Councillor Ferguson.
Thank you, Chair. Thank you for that. I think I'm actually going to put another proposal on the table, and I'm going to propose that we go with the recommendation to get them opened, because Barry, you've quite clearly said that you can't stand over any other risk assessment apart from the one that you've presented us today. But on the basis, like you've said, that we work with the Brandywell to maybe procure some covering so that can be expanded, because where I take from what Councillor Rogue is saying, you know, they might not need that covered every day, but we do live in Northern Ireland and we don't know what days they will need it. We can't predict that, so there is that risk, and it is our staff that we are putting at risk. So I would like to propose that we do go with the recommendation that Barry's put forward, with the basis that council officers will work with the Brandywell so that they can look at the other options of covering to expand on that number.
Seconder for that proposal. Okay, thank you. Is that you finished, Councillor Harkin? Yeah.
I was just saying that, like, I was happy to support that, but that could we amend Councillor Ferguson's proposal to include what Councillor Logue said, and to bring for Barry and his team to bring a paper to the full council meeting, taking on board the proposals about increasing the numbers, so that it's not just dead in a ditch, that there's actually a plan.
Okay, thank you. Right, we have three proposals here. Do we need to take a vote on each proposal? Yes. Okay. Okay. So
I'll withdraw mine, if that's okay, just to make it easier. And I would be happy to support Councillor Ferguson's.
So that brings us down to two proposals. We have Councillor Logue's and Councillor Ferguson's that was amended by Councillor Harkin. Do we want to take a vote on, on those two? Do you want to come on, Councillor Harkin?
Sorry, I thought I had amended Councillor Ferguson's motion to say support the proposal coming from the officer, but that the add date that in addition to doing that, we would bring a report to the full council based on the issues raised by Councillor Donnelly and Councillor Logue.
Now take a vote on Councillor Logue's proposal. All those in favour of Councillor Logue's proposal? And all those against Councillor Logue's? Any abstentions? Yeah, so 4 for, 6 against, and 1 abstention, so that motion falls. So we're now going to vote on the second. Yeah. Yeah. That's Councillor Harkin's proposal. Seconded by Councillor Ferguson, seconded by Councillor Harkin. All those for this proposal in favour? And that proposal is unanimous. So we're going with the second proposal. That would seem. Happy enough, Barry?
Here, just the second part of my proposal too regarding the sports hall, is that a separate proposal that they work with?
Are we all those in favour of the second this proposal?
Sure, could I just come in on that just to give a wee bit of an update where we're at with tier 2 sites? And I probably didn't answer, Patricia, your question about furlough. I suppose what we've been asked by the lead finance officers to maximise the furlough scheme in council because of our financial position. So we've unfurloughed all our staff around pitches, 3G, our tier 1 leisure sites, but council hasn't made a decision about opening any of our tier 2. So currently we've Melvin Arena, Melvin's shut, Brook Park, both buildings are shut. City Baths is shut. Bishopsfield Sports Hall, but Bishopsfield 3G is open. So we've been asked by the chief executive and the lead finance officer to keep it under review. But from a financial point of view, at the minute, not to unfurlough those staff. We have part-time unfurloughed some of them, just in terms of getting the 3G operation going. So the rationale was that tier 2 sites aren't open as yet, difficult to adequately socially distance, and none of our sports halls, even our tier 1 sites, are open for sports hall activity. They're open for classes only because of the guidelines from the executive around the social distancing. So we have none of our actual sports halls presently open at this moment in time.
Councillor Burke.
Thanks for letting me on, Chair. I can understand, obviously, the financial aspects of it, but the Craigan Sports Hall, sporting aside, I understand the guidelines around it. It's been, obviously, we've talked about how, obviously, coming out of COVID and the recovery and the mental health side of it, that sports hall is used by the community as well in terms of other programs. It's not just obviously sporting, and I know obviously working up there and other groups are up there would utilise that thing, because at the minute we're struggling obviously arranging projects and programs because of size and of rooms and halls and stuff, whereas we have that big empty sports hall which is massive. It's one of probably the biggest indoor venues I'd imagine in the city, but it's key that we need that up and running just to try and get back to normality, try and get groups back in. Again, sports aside, it's not just the sporting element, it's the well-being, it's the, like the community sort of side of it. That's why we need it pushed on, because the way it's going now in terms of Craigan, there's no facilities to cater for projects, and that's from like the ULT, all Cornbeef Town, all community groups up there are struggling to find space, which is why I would urge you to look at reopening it as soon as possible. Thanks.
Just to add to that, that mightn't necessarily mean on-furlough on staff. We have to look at there's the COVID recovery fund, and that means working with communities, and part of that could be with them and doing whatever for the amount of time that they're in. Thank you.
Is that a second proposal, Councillor Burke? Yes. So we have proposed and seconded. So all those in favour of this proposal? All those against? Any abstentions? Okay, we have 4 for, 3 against, and 1 abstention, so that is carried. Okay, folks.
Oh, sorry. 3.
Sorry, there's 5 against. Yeah, we'll just do that again. Just for this is getting a bit muddied. Yeah. So we'll take a vote for the proposal from Councillor Lowe. You restate the proposal. It's to open the Craigan Sports Hall. Do you want, Councillor Lowe, do you want to clarify here?
Open the Craigan Sports Hall.
Okay. So all those for this proposal, Councillor Lowe. All those All those against? Any abstentions? So that's 4 for, 6 against, and 1 abstention. So that motion falls.
Sure. Just for clarity on that as well, whether based on what Councillor Burke has said, it's known as a Bishop's Field Sports Hall and open. Now there is a bit of sports activity going on, but look, we will be working with local communities in terms of the COVID recovery and all of the rest. And if there are community type activities, council have made a decision not to open our tier 2 leisure sites for a number of reasons. Financial being one, not being able to adequately socially distance. You'd have more staff in than you would have members of the public actually in using them. But Councillor Logue, I think, has highlighted there may be exceptional circumstances that facility can be opened without staff. A key holder from another building can go to get the community, and we did it during the food parcel. So if there are other things, look, what we will do is get our community development team to work with the community up there. It's not a carte blanche, it's shut, but if there's community activity required, and it'll be the same with all our others, we can work on that. It's not just it's closed for the next month or whatever, but for adequate sports events and that wouldn't be able to socially distance. So look, we will get the community development team on members to work with the community in that as well.
Can I just ask, does that include classes?
We'll
Community
check.
exercise classes, not no like circuit. No, the only one I'm talking about classes.
Yeah,
where there is social distancing that's happening across all our centres.
Yeah, through yourself, Chair, we'll look at that with the community. So in terms of.
Thank you, Councillor Farrell.
Thanks, Chair. It was unfortunate that we weren't aware of this in advance, and we had to make a decision. Barry has clearly outlined that none of the tier 2 sites are open, and me personally, I can't just say, oh, we should open Craigan and not open any of the rest of them. They're all very different, but as Barry has suggested, I think it's sensible that probably each one of them is reviewed to see, is it now safe to open, and that's what we should be aiming for. So thanks.
Thank you, Councillor Farrell. Can we move to that comfort break, folks? 45 minutes later. Thank you.